Good evening, I'm Michael and you're watching Kini News, the show that brings you today's biggest stories. Jail time and a massive fine, that will be Najib's punishment after he was found guilty for all 7 charges related to SRC International. Former Prime Minister Najib Abdul Razak has been sentenced to 12 years jail and fined 210 million ringgit for abuse of power.
Saya amat kecewa dengan kehakiman dalam kes SRC kerana pihak kami yakni yang diketuai oleh Tan Sri Syafiee, peguam-peguam saya telah memberi hujah-hujah yang boleh membawa kepada banyak keraguan dalam kes ini. Namun ia tidak diterima. Namun demikian, rayuan ke Mahkamah Rayuan akan kita lakukan secepat mungkin, dan saya berharap bahawa kes di rayuan ini akan didengari dengan berapa segera yang boleh, kerana saya ingin teruskan usaha untuk membersihkan nama saya, dan perjuangan ini akan tetap saya teruskan.
For the 3 criminal breach of trust charges, Justice Mohd Nazlan Ghazali sentenced Najib to 10 years jail for each offence. For the money laundering charges, the jail term is 10 years for each offence. The jail terms are to run concurrently. Earlier today, Najib was found guilty of all 7 charges related to the 42 million ringgit from SRC International Sdn Bhd. Najib was calm when the judge delivered his verdict at the Kuala Lumpur High Court. The judge ruled that the defence failed to raise reasonable doubt in the prosecution's case. This marked the first conviction against Najib in the multiple 1MDB-linked criminal cases against the former finance minister. SRC International was a former subsidiary of 1MDB before it was fully owned by MOF Incorporated. We went from single-digit daily cases to recording high double-digit daily increases. This is the country's latest COVID-19 situation. Today, Malaysia recorded the highest number of new cases in more than a month, with 28 local transmissions and 11 imported infections for a total of 39 new cases. The last time the country recorded a higher number of cases was on June 15th at 41 cases. Health Ministry Director General Dr. Najib Abdullah also reported the emergence of 2 new COVID-19 clusters, namely the Satok cluster in Sarawak and the PUI Sivaganga cluster in Kedah. The Satok cluster recorded 4 new cases involving Malaysians, while the PUI Sivaganga cluster saw 5 new cases involving 1 Malaysian and 4 non-citizens. Sarawak continues to lead as the state with the most local infections with 21 cases. Meanwhile, 6 people were discharged after recovering. No new COVID-related fatalities were reported today. The Health Ministry has constantly reminded Malaysians to wear face masks and to practice social distancing. Our Health DG repeats it almost every day. But if you saw the scenes outside the KL Court complex today, you may think we've beaten COVID-19. Almost every day since the MCO started, Health Ministry Director General Dr. Najib Abdullah has reminded Malaysians to comply with the standard operating procedures to curb the spread of COVID-19. However, his advice seems to have fallen on deaf ears. In seeming disregard to the SOPs, thousands gathered outside the courthouse to await the decision in former Prime Minister Najib Abdul Razak's 42 million ringgit 1MDB-linked SRC International case this morning. The lack of self-control shown by crowds which had gathered at the Kuala Lumpur court complex left Dr. Hisham disappointed. Social distancing measures of over 1 metre and the use of face masks were not seen to be observed, sparking COVID-19 fears among reporters and netizens. Commenting on the situation, Dr. Hisham pointed out that health officials have reminded the public daily on the SOPs during the health crisis. Meanwhile, the police have reminded the crowd outside to adhere to the COVID-19 SOPs rather than taking drastic action against some of them for breaching the SOP. Central Police Chief S. Shanmugamurthy Chinaya told reporters that the crowd, who initially ignored the advice, began to listen to the police after repeated reminders. Perikatan national lawmakers accused Muhammad Sabri of misleading the House. So what did he say to get such reactions? Let's take a look. De facto Religious Affairs Minister Zulkifli Muhammad has rebutted an assertion by Amanah President Muhammad Sabu that Prophet Muhammad was a refugee. He was responding to a supplementary question by Sabak Bernam MP Muhammad Faziah Muhammad Fakir on whether the Amanah leader had insulted the Prophet by calling him a refugee.
Saya teringat dalam satu kitab Fiqhus Sirah yang dikaryakan oleh guru kami Syekh Muhammad Said Ramadan Al-Buti. Bila mana beliau mentarifkan hijrah, di mana beliau menyatakan bahawa Rasulullah sallallahu alaihi wasallam tak kala hijrah ke kota Madinah bukanlah bermakna Rasulullah melarikan diri dengan hanya melarikan diri begitu, tetapi adalah atas perintah dan tuntutan Allah Subhanahu wa taala.
However, Zulkifli did not state a stance on whether Mat Sabu's assertion was an insulting remark. According to Muslim tradition, Prophet Muhammad, who had been facing persecution in Mecca, had been instructed by God to leave for Medina, whose people had vowed to give him protection if he were to stay with them. On the night of his departure, a siege was laid on his house by Meccans who had planned to kill him. The Prophet, however, managed to escape and hid in a cave for several days to evade his would-be assassins before finally making the journey to Medina. Mat Sabu had used this event as an example to say that the Prophet was considered a refugee. The Amanah leader had said this in warning against painting all refugees with a negative brush and wishing them harm. Kuala Lumpur is set to revamp how it hands out liquor sale licenses.
The government is set to roll out new guidelines for the granting of liquor sale licenses that will consider several factors, including sensitivities of the community and sale time. Federal Territories Minister Anwar Musa told the Dewan Rakyat today that Kuala Lumpur City Hall, or DBKL, is set to complete the guidelines in early August. After that, it will be up to the licensing board to convene and decide on the granting of licenses in accordance with the new guidelines.
Selain daripada itu yang berhormat, kepada soalan bilakah lesen-lesen baru ini boleh dikeluarkan, untuk makluman yang berhormat, lembaga pelesenan yang berkenaan telah pun dilantik. Mereka dijangka akan bersidang bulan hadapan dan diharapkan bila mereka bersidang sudah ada garis panduan baru yang lebih kemas, lebih teratur bagi mengelakkan ataupun sekurang-kurangnya membantu mengurangkan peristiwa-peristiwa yang saya maksudkan tadi.
In a follow-up question, Kuala Krai MP Abdul Latif Abdul Rahman asked if the government intended to limit the sale of alcohol in Muslim areas in Kuala Lumpur.
Seperti mana yang kita semua faham, soal lesen arak, ianya diperlesenkan kerana ia perlu dikawal. Dan kawalan itu adalah bagi menjaga kepentingan awam, menjaga keharmonian dan sebagainya. Dan ini tidak tertakluk hanya kepada negara kita, hatta negara-negara barat sekalipun. Mereka mempunyai kawalan yang agak ketat dan teratur. Tetapi ada tendensi, saya kata, ada tendensi dalam negara kita, perkara itu semakin hari menjadi semakin longgar. Dan ini adalah menjadi tanggungjawab kita nak menjaga kepentingan awam, bahawasanya garis panduan perlulah lebih teratur. Sudah tentulah penjualan minuman keras tidak boleh nak disamakan dengan penjualan cordial ataupun minuman biasa. Sebab dia akan menjejaskan orang lain selain daripada peminum, seperti mana kita tahu.
Earlier, Bukit Bendera MP Wong Hon Wai had asked why the guidelines were still not ready, since it had been 58 days since the suspension of new liquor sale licenses. He also questioned if stakeholders were consulted. Anwar said stakeholders were welcome to provide feedback on the guidelines. The minister added that criticisms against the suspension by the opposition appeared to be exaggerated.
Coming up next, a doctor shares how contracting COVID-19 was a humbling experience. A doctor in Miami reflects on contracting COVID-19 and says it taught him how to be humble. Back in June, when Florida's COVID-19 cases took a sharp turn upwards, Dr. Mark Supino worked night shifts treating patients with coronavirus and other complications at Miami's Jackson Memorial Hospital. And by late June, he contracted the virus himself.
I was very fortunate. When I had COVID, I had very mild symptoms. I wasn't bedbound. I was only really ill for a couple of days. And then I was able to sort of get out of it. I never had respiratory symptoms. I didn't have to go to the hospital. But some of my colleagues were in bed for 2 weeks. It's unpredictable.
He said his symptoms lasted 5 days, but even weeks later, his sense of taste and smell are still reduced. Being infected with the same virus as his patients, especially a virus that is still unknown, he said has allowed him to have a strong sense of empathy.
This has taught me to be humble. So I would like to think that my approach to patient care would have nothing to do with me being afflicted with the same illness. Where I will tell you I've learned a lot was when I have been making the callbacks, and I was actually making the callbacks while I was sick at home, off work. So it was safe for me to call people because you can't transmit through the phone. And I was calling people back to let them know that they were positive and listening to their questions and their concern and the isolation. And in those moments, relating to them as someone who was ill, I felt it. I definitely felt it.
Florida currently has the third largest coronavirus outbreak in the nation, behind California and New York. On Friday, the total number of coronavirus cases in Florida rose to more than 402,000, and the number of deaths from the virus rose by 136, totaling more than 5,700 deaths in the state on Friday. And despite the percentage of positive tests rising in the state indicating widespread community transmissions, Florida has not issued a statewide mask mandate.
I feel like maybe we have failed people by not getting everyone on board. And I do feel that the reticence to embrace sort of a position of wearing masks and sort of protecting everyone is a coping mechanism. I think there are a lot of people who are scared. So I'm a little disappointed that we haven't been able to modify that situation.
As for Supino and his colleagues, he says they are trying to help as many people while keeping their heads above water as the number continues to soar in their state. Morden says it has started a US government-backed late-stage trial for its COVID-19 vaccine candidate. Biotech company Morden on Monday said it has started a US government-backed late-stage trial to test the effectiveness of its COVID-19 vaccine candidate. The first such study under the Trump administration's Operation Warp Speed anti-coronavirus program. The federal government is supporting Moderna's vaccine project with nearly $1 billion. The study will test the response to the vaccine in 30,000 adults who do not have the respiratory illness. More than 150 vaccine candidates are in various stages of development globally, but Moderna is leading the race along with AstraZeneca with their candidate in late-stage studies. Pending the study's results, Moderna said it's on track to deliver 500 million to 1 billion doses each year, beginning 2021. Shares of Moderna jumped in early Monday trading. Its stock rose 9%. Meanwhile, Pfizer has an agreement to sell vaccines for 50 million people to the US government for around $2 billion if the vaccine is effective. Pfizer said that if the trial was successful, it could seek regulatory approval as soon as October and supply vaccines for 50 million patients at 2 doses each by the end of the year. And that is all from me today. For more stories, you can go to KiniTV.com. You can also follow us on Instagram, Twitter, YouTube and Facebook for the latest news updates. I'll be back with more tomorrow, same time, same place. I'm Prasad Michael. Thank you for watching.